hip flexion, four-way hip. The first thing that you want to be concerned with this exercise is the ball of the hip and making sure it's aligned correctly to this pivot. So as Billy kind of moves side to side, you can kind of feel the ball of his hip joint, and it should be parallel to this pivot joint here. You're going to place the prescribed amount of weight on the stack. On the support leg, you're going to have a slight bend, so that's like a little shock absorber. You don't want it completely locked out, so a slight bend. Billy's going to go ahead and place his knee behind the pad itself. The pad should be located, as you can see, right at the top of his knee. So the pad should sit comfortably here on your knee, not on the actual patella, and not too high up on your quadricep, but right here at the tip of your patella. So you've got a slight bend here, chest up, good posture. You're going to go ahead and relax. You don't want your femur or your thigh bone to come past your other thigh bone. So I really don't want you getting into this fully extended position here. You can see how it's changed the posture and of his spine here. Like it's not so healthy. So the legs should stay parallel. Slight bend at the knee here. Billy's going to go ahead and drive it up so that his femur is horizontal to the floor. Under control, return. Good. That's perfect speed. Up to the top and return. Up to the top and return. That's perfect. So you see a slight bend in the leg. You see this support leg is slightly flexed, enabling him to absorb some pressure. Perfect. And this is going to work your hip flexors. So one more rep, Billy. Good. And then you would also work the same number of repetitions on the other side. So we're going to turn to the pad to about a 30-degree angle here. You see at the top here, about 30 degrees. You're going to go ahead and load it. Perfect. Chest up, good posture. Weight on the support leg, slight bend. Perfect. Nothing past the thigh bone. Perfect.